Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice. That is Hatvet's YouTube channel.
Dr. Chandrashekhar sir is a renowned clinician having a clinical experience of more than 20 years in small animal practice. He has pursued a postgraduate degree and a doctorate in veterinary clinical medicine. Currently serving as a professor in the Department of Veterinary Clinical Medicine at MVC Chennai, he specializes in veterinary medical oncology and small animal internal medicine. Hatvet family extends a heartfelt gratitude to Dr. Chandrashekhar sir for sharing insightful content with our fellow veterinarians. Thank you, sir.
Respected practicing veterinarian, educational partner, Dr. Raj, Hatvet Pharma Private Limited. So today's topic I would like to discuss about brachiocephalic airway syndrome. It's a very common problem in small animal practice. So you all know that I am a professor of clinical medicine in charge of emergency critical care, running a chain of hospital in Chennai. So the purpose of this discussing this topic to create awareness to pet parents and provide the technical skill to the practicing veterinarian. So, normally I'll tell you how I proceed to treat brachiocephalic airway syndrome. Short nose breeds like Pug, Shih Tzu, Boxer, and these type of breeds are called as brachiocephalic breeds or brachiocephalic dogs. They are prone to get these problems. What are the problems? There are various classifications available. One of the common problem is stenotic nerve. Stenotic nerve is this nostril itself narrowed. That is the stenotic nerve. So what you have to do is you have to keep the nostril opening bigger. That is the technique which you are going to do after hearing this presentation. Another complaint in brachiocephalic dogs, you have elongated soft palate. Imagine there is a trachea here. The soft palate, if it is elongated, it masking the soft palate is elongated and masking the tracheal opening. Imagine this is the tracheal opening. The elongated soft palate, it is coming from the upper part of the oral cavity, roof of the oral cavity. It is completely masking, means the animal, they will not be in a position to breathe. That is the reason most of the brachiocephalic dogs, they always come with both expiratory and inspiratory dyspnea, because they don't have a normal airway movement at the tracheal inlet, because that was covered by the elongated soft palate. This is one thing. But how do you identify as a veterinarian this elongated soft palate? You cannot identify just by looking at the animal. So there are certain guidelines normally I follow. And the animal with the breathing distress, as soon as presented to me, what I will do normally, I will not trouble the patients. Just I will keep them, they imagine the dog is coming here with the breathing distress or panting. And normally what I do, in that position itself, I will keep the animal in an air conditioned room. The cooling of the body and the nasal mucosa, it will help them, relaxed. Another thing, I will keep the flow by oxygen. So imagine this, my finger is the dog nasal cavity. I'll keep the flow by oxygen very nearer to the nostril without disturbance. I won't even collect the blood. So when you are keeping the flow by oxygen very nearer to the nostril, animal will get 40 to 60% of the saturated oxygen, and it can regain the consciousness. That is the important message I would like to share. And this is very important. I don't even collect the blood for testing. I don't even do the arterial blood gas analysis. I don't even do venous blood gas analysis. First of all, brachiocephalic dog presented with the breathing distress. The entire family will come. First of all, I'll ask the owner to sit and relax in the waiting area. I will ask my student and then my resident to bring the dog inside the emergency room. I will keep him in the air conditioned room, and then I'll give the flow by oxygen. With this itself, we found a lot of success. There are failure which I faced in the past. Immediately some of my residents, they were interested to collect the blood and they want to identify the cause for the distress, whether the hepatic, renal, or cardiac problem, or valvular disease, and there's so many things it will go in the mind. And we face a lot of problems, lot of mortality we encounter. Whenever we see a patient, whenever we get the patient, if you are disturbing the patient and collecting the blood, and we get, what I'll say, we get a lot of mortality in the process. So the message, what I'll do normally, as soon as the case presented to me, I will give the flow by oxygen. I will maintain them for a couple of minutes. That will give a lot of success. I don't even collect the blood. I don't even put the animal with a lot of physical examination, lot of stress. So that is the way with this method, we found a lot of success rate. This is the immediate examination, immediate attention normally we give for patient with breathing distress due to brachiocephalic, breed specific abnormalities. Whether the problem may be due to stenotic nerve, or elongated soft palate, or problem due to everted laryngeal saccule, or hypoplastic trachea, whatever may be the issue. First of all, we stabilize the patients by giving the flow by oxygen and keeping in the air conditioned room. This gives us a lot of success rate. And the same animal, the message to the student, if you are interested to know, because the animal is having a lot of breathing distress, if you take the animal for X-ray, putting this side and that side ventrodorsal view, in that occasions we face a lot of failures and a lot of mortality we encounter. So the message, to the student and the academicians, and brachiocephalic dogs, we need to handle them gently. We should not handle them very rough. That is the message. A lot of overzealous investigations we can do after some time, after stabilizing the patients. Another important message to the pet parents, and many occasions when they bring the hospital with the choke chain with the collar, and then accidentally they're taking the dog from one unit to another unit, pulling the dog with their chain, with the choke chain and leash, and too much compression of the trachea. Already the animal is maybe having stenotic nerve, or it may be having a elongated soft palate, or it may be having a everted laryngeal saccules, or hypoplastic trachea. And normally these breeds, you cannot breathe like a dog which are having a long nose. So the message is to the pet parents, avoid the animal giving lot of stress. Too much stress, it will cause a lot of discomfort to the animal. We face a lot of you lose the even the pets. So what you need to do, the animal should not be stressed. If they are having too much breathing distress, animal too much panting, there is a difficulty in inspiration and expiration. Better keep the animal without any disturbance. That is an important message which I would like to share. And then if you are taking to one unit to another unit, you take them gently, or hold it like a baby in your hand and move them from one place to another place. Then it will feel comfortable. When they are with the owner hand, they will get relaxed. And you should not fold the head and neck. You will have to leave them free. And if you are holding them very tight, and every possibility that itself causes stress to the animal. It will aggravate, the condition become worse. Another important message, I told you, as soon as the case presented with the breathing distress, especially brachiocephalic dogs, and in the normally what I give, I'll give them the air conditioner, I'll give the flow by oxygen. While giving the flow by oxygen, I'll advise the owner to mask the eye. If you mask the eye, what will happen? If you mask the eye and suppose the veterinarian is handling, some of the dog, they don't like new person handling very nearer to the eye. Anything moving very faster, dog psychology, they try to attract, they try to try to hold it. So if you are very you want to do intubation or doing so many other things, every possibility that will bite. And the dog which are ferocious, friendly dog, they don't do. Animal with the comatose is not a problem, but see that there should not be too much. Animal should not be stressed. Another important message is, and you can cover the eye also with some soft cloth. You can cover. That will animal will feel relaxed, and you can do the procedure, or you can give the flow by oxygen, and the animal won't do anything. This is another important thing. And message to the practicing vet: whenever you handle the brachiocephalic tree for blood collection and other things, you cannot tie the mouth, and because the mouth is very smaller, and you cannot tie the mouth. Don't attempt to tie also. And what you can do is, maybe you can use a soft towel to cover their head and body. Ask the pet parents who are all very close to the dog, and also too much people handling also we have to avoid. One person should restrain with a soft towel or the bigger towel, but it should not obstruct the nasal cavity or oral cavity, and they should fold it gently. Then after that, what you have to do it, and you can collect the blood from saphenous vein or cephalic. Normally, collecting the blood from saphenous vein will be ideal, because the animal won't sleep. But they know who is holding, who is handling. But someone very close to the dog, if they are holding, you will not have a problem of blood collection or other examinations. So that's an important thing. And another important thing is, you have to observe the animal closely. So far I told distance examination, stabilization. You need to observe the animal very close. What are the problem you need to look? You look at the nostril, whether the nostril is properly open or it is closed. Then after that, this is easily possible. Nasal cavity passage, and how much is having the opening area. This, by looking at it, you can make out. But elongated soft-bladed everter language, you have to sedate the animal. Normally, what I do for sedation, I use butyrophenol 0.2 mg per kg body weight, and that will give a complete sedation to the animal, and the animal also will cooperate. And I needed two people extra. One has to open the upper jaw, another has to open the lower jaw. Then I will apply the lignocaine spray to the oral cavity. Then I will also use the ET tube. Depends upon the size of the weight of the animal and size of the animal. We'll select the size of the ET tube. Then one of the easiest method of selecting ET tube is nasal septum. Keep the ET tube nearer to the nasal septum. That almost the diameter of the trachea, so that the same circumference width you can take, and apply some lignocaine spray on the ET tube. Then also apply lignocaine spray to the caudal part of the oral cavity, so that you are desensitize the area, and then ask someone to open the mouth. Then you can intubate it, and the intubation, you can see during the process. You can also check the elongated soft palate and the presence of everter laryngeal sac. That's the way you have to identify the elongated soft palate or everter laryngeal saccule. You can also take CT. CT also you can identify elongated soft palate and everter laryngeal saccules. And you can also identify with the X-ray hypoplastic trachea. All those things you can identify. But when you it is not like a stenotic nerve. Stenotic nerve, just by looking at the dog nasal cavity, you can make out very easily. And because when you observing the nasal opening, in that itself, what is your plan, what you can do for the animal, how best you can relieve the breathing disorders, and all those things you can plan. That is very easy and simple. By looking at it, you can make it. And another important thing, the handling, I told you, gentle and smooth. And suppose this having a stenotic nerve, what is the technique normally followed? No? There are stenotic nerve, they make an incision laterally. There are vertical incision they make on the stenotic nerve area, and make it opening bigger. And before that, all these breathe and check that the platelet level, PT, APTT level, fibrinogen levels are within the normal limit. Without checking it, if you are sedating with the buterfenol and controlling the animal, after that keeping them with gas anesthesia, and you are cutting with even the high-end equipments, and the animal which are having bleeding disorders, animal which are having less platelet count, animal which are having fibrinogen defect, animal which are having clotting factor defect, animal which are having PT, APTT abnormalities, naturally you will have a bleeding disorders. It will keep bleeding. You cannot control. Maybe the availability of cutting and the cautery equipment, you can somehow you can cauterize the area. But unless you separate the primary problem, and if you are doing this procedure, there is every possibility bleeding will be there. That is another important message I would like to stress to the academic community. Actually, this pug rearing all over the world, it has increased after there is a company called Hutch. They entered into the mobile business. And even today, some of the pet parents, they used to tell me, sir, we have a Hutch dog. They didn't mention about the pug name of the breed. They mentioned like a Hutch dog, because Hutch phone, when they want to do a mobile business in India, they kept big banners starting the puppy smaller size, middle size, bigger size, how they are following the children, how they are following the elderly people, all those things, big advertisements. It's given a lot of information to the children, a lot of information to the pet parents, and the people buying tendency also increased, and they insisted to get only these type of breed. They want to keep it. When they keep these type of breed, they must know about the brachiocephalic syndrome. What are the techniques? How best they can take care? All those things they should understand. Pet parents must understand. It is the duty of the veterinarian, attending veterinarian, to educate them about the stenotic nerve problem, everted laryngeal saccule, elongated soft bone. It is our duty. And the main important thing is, as far as my knowledge goes, in the past, for the past 20 years, and client counseling is the major factors that we lack. And if you can give the proper client counseling, they are moving from you to other, or moving to Google, consulting so many people is not a problem. But at least if you give the good client counseling, the people will understand their vet problems. They can Google it. They can consult with so many other veterinarians also in the world, India, abroad, or so many places. But the message will be the same in a different platform. They'll get app mode, they'll get it email mode, they'll get it by social media mode, or payment mode, any mode they'll get it. But when you have when you give the correct information to the pet parents, and they will also be convinced, and they will understand the consequences of the problem, all the legal issues, all the other attention problem can be avoided. Pet parents also prepared for the brachiocephalic syndrome related eventuality, or the end result of the worst conditions. They will be in a position to understand, and they will also be part of our program. And whenever we want to do any procedure or the work, they will be with us. They will understand the consequences of the problems. So this is another important message I would like to share. And suppose you want to correct the elongated soft palate, what normally they do. And after the sedation and with putting an ET tube placement and connecting with the isoflurane or sevoflurane gas anesthesia. And the elongated soft palate, they put a small stay suture, they pull it, and then the excess area they cut it. There are laser equipment available. With the help of what, if you cut it, there won't be any bleeding. There are cautery also available. You can cut and clot. That is also easy way to the elongated soft palate. You can cut it, and and already I told the PT, APTT, fibrinogen, platelet, they all should be within the normal limit. Without that, if you are proceeding the surgery, if you don't have a cut and the cautery machines, if you don't have a laser equipment, manually you are doing and putting in sutures, and definitely it will bleed, and the bleeding it will cause aspiration pneumonia. They say in the research papers, the majority of the problem in brachiocephalic airway syndrome surgery, aspiration is one of the problems. So if you don't control the bleeding, there every possibility the blood, whatever is available in the from the surgery, it will get into the trachea, and that result in aspiration pneumonia. Again, it will aggravate the problem of the distress. Breathing distress will aggravate. They will face a lot of consequences. This is another important message I would like to share to the practicing or the teaching community. Another important thing is what I would like to stress. Even the everted laryngeal saccule also, you can use endoscope for this, elongated soft palate visualization. Even everted laryngeal saccule visualization, we can use endoscopy. Endoscopy, we can visualize the area, and then with the there is a provision available. You can also locate the area and then pinpoint the area. Then after that, put a stay sutures with visualizing the endoscopy.
Hatvet Pharma presents Hatpod, cefpodoxime syrup and tablets, the safe and effective choice for stubborn infections. Hatpod is available in the following formats: cefpodoxime proxetil dispersible tablets, Hatpod 100 dt tablets; cefpodoxime proxetil dispersible tablets, Hatpod 200 dt tablets; cefpodoxime oral suspension, Hatpod 100 ds. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com. Thank you.
Then you can bring it closer to, bring it a little bit away from the attachment. Then you can resect it, and then by using the laser therapy or by using the cutting and the cautery equipment, you can arrest the bleeding, so you can make the animal become comfortable. So this is the way normally they manage elongated soft palate, everted laryngeal saccules, stenotic nerve. Normally they manage like this all over the world. There are different approaches, different methodology, but all these things, so far I told are coming under this category only. And I'll move on to the slides one by one. These are all the breeds, the prone to get the problems. So breeds like bulldog, and a breed like boxer, breed like shih tzu, breed like pug, and all these breeds, the prone to get the problems. So when you are buying the pet parents, the message to the pet parents, when you are buying these breeds, you must understand that they are prone to get all these complaints. So better you talk to your vet, and or the vet, they have to explain to them. There are occasion, animal they would have bought it for vaccination in a hot summer from their house to your hospital, and when they are returning home, suddenly breathing distress and dyspnea and vomiting and sudden recumbency, convulsion and death also they encounter. So the message is, animal stressed during summer month, without air conditioning they are bringing, and too much stress. You would have put only vaccination. And there are occasions the pet parent will ask the vet, you didn't tell about the prognosis of the case, you didn't tell about the condition of the dog, what are the problem that breed is prone to get it. All those things we should have, they will ask. We have to tell them. If you can tell them, if you can tell them well in advance, we can avoid all these problems. Tell them that these breeds are short nose breeds, and they have a, they stress during summertime. They should be in an air conditioned room or the cool environment. They should not be transported without any air conditioning. And without air conditioning, they transport to the hospital or the clinic. Every possibility they prone to develop breathing distress, and that will end up with the other organ involvement, organ compromise, and we'll face mortality among these breeds. So all those things, we have to explain to them. Another important thing is, in this image you can see normally they say they should have a nasal opening, but this nasal opening, the small nasal opening is there. Majority of them getting occluded. You can see it get occluded. So normally the surgeons, what they do, they cut the occluded part and make the nasal cavity opening better, so it can breathe better. They can get enough amount of oxygen inside, and the animal will get a better quality of life. Because of this anatomical defect, and these breed prone to get various problem in their lifetime. So it is the duty of the vets when they examining this type of narrow nostril in a small breed or the brachiocephalic dogs. You have to explain to them, take the photograph of the dog and head and the nostril. Just explain to them these are all the issues that has to be corrected. Once they agree, you can go ahead with your procedure, and you can save the animals. This is one important thing. This is possible with a naked eye. You can examine. Simple test, all the clotting factor, fibrinogen, PTA, PTT should be normal. If all these things are normal, you can do a resection, and can give a good quality of life to the animal. But inside elongated subtle, everted laryngeal saccule, all those things you need to sedate the animal, open the oral cavity, then only you can identify. These weeks boxers also short nosed, and it may be having elongated soft palate. You can see the animal which are having elongated soft palate that goes the tracheal area, and they have open mouth breathing like this. And you can see the soft palate extending into the larynx. See, almost closing the tracheal area, and extending to the larynx and up to the tip of the epiglottis. There is no space for animal to breathe. That's the reason these breed pant heavily. Suddenly they become unconscious and go for multi-organ involvement and other issues. This is a stenotic nerve, and so you can see the normal nose. You can see the good opening of the nasal cavity. You can also see the everted laryngeal saccules. There are larynx here. Adjacent to that, you can see the everted laryngeal saccules. And this also, almost it is closing the tracheal opening. So naturally, they'll have a breathing distress. They get a less amount of oxygen inside, and they end up with various breathing related disorders, and end up with the various other organ involvement. And then tongue depressor is depressing the epiglottis to allow visualization of the laryngeal saccules. Sometimes, normally when you put an ET tube, the message is you should not touch the epiglottis. Caudal part of the oral cavity, that is the tongue, caudal part of the tongue, if you compress it, automatically epiglottis will open, you can check it. But This is between the larynx and the epiglottis, the everter laryngeal saccule. To see that, you have to compress the epiglottis. Once you compress the epiglottis only, you can able to see the everter laryngeal saccule. The small saccule and all, you need to compress and check. If it is a bigger saccule and all, you can easily visualize by looking at the oral cavity, caudal part of the oral cavity itself. This is another important message. So it needs a team. It needs a trained team. Majority of the time in the hospital, and if you don't have trained team, you face lot of problems. So you cannot save the animal on time. All the procedure has to be done in a fraction of a second and within 2 or 3 minutes. So that means you should have a trained team. Though if putting an ET tube is a small technique, but it's an important technique in emergency critical care setup. So that is the reason, unless your hand, eye are not trained, your people are not trained, and the small technique you will not be able to do it on time. So ultimately you lose the patients. The message is, you must have trained team. Even not necessarily they should be a veterinarian to just open the mouth and put bringing the laryngoscope with the light source, but they should be trained. They should be trained. Even you are a technician in that's what the Teresa Possum book, Emergency Critical, are also mentioning. The people are available in the veterinary hospital. The people are available in the emergency critical care. Your staff should be trained. Many times, your colleague may not be available and required people are not available. That time, when you want to do an example, when you want to put an ET tube, single man opening and putting an ET tube becomes challenging, and it's a small difficulty is there. So if you have trained team, someone can open and you can use the laryngoscope, see the epiglottis opening, then put an ET tube, identify whether the laryngeal saccule is there, elongated software or other problem. You can check and then you can usually identify the problem and correct it. The message from this slide: trained team, train all the people in your unit is very, very important, and you should make them to become animal lover, and always go say healthy animal, treat the animal with the treat, not only with the injection alone. And this we put the comparative pictures. One of the left side of the pictures, you can see almost the nasal cavity closed because of the stenotic condition. Here you have a small opening. Here you have a small opening, but even then, almost 70% of the nasal opening closed. After the resection, lateral side is resected, and you can see the big openings. Animal, breathe better. That's the message about that slide. This again, other breeds, how they get stenotic nerve. And now I think this is very clear. See, you can see the epiglottis, and now we can see the elongated soft palate is completely occluding the epiglottis and trachea. You cannot even see the trachea. How the animal can breathe. So the message to the vet: kindly sedate the animal with the butorphanol 0.3 mg per kg body weight after getting consent from the owner. Your owner also should be informed about the pros and cons of the procedure. If you don't inform the owner and keep doing the procedure, and ultimately I told everything has to be done within a fraction of a second and a minute. If you don't have a trained team, if you don't have all the accessories on time, every possibility is you may miss the patient, and you will have to face a lot of other problems. So the message is, get the consent, then go out with the examination. And if you find the elongated soft palate obstructing the trachea or the epiglottis, you tell the owner that this in the image you can see this particular elongated soft palate. They'll resect it. After the resection, they put a simple continuous sutures, and it will heal better. The animal also breathe better, and then the longevity also improves. This is the CT scan of the brachiocephalic dog. You can see the black area and all containing hair, and now you see the anatomical confirmation. Because it's having a short nose, and then the availability of the oxygen in the nasal cavity or the take-up of the oxygen through the nostril to the nasal cavity also minimum. And these breed even other external factors like heat stroke or too much handling, and the vet hospital, many of the people, or the train attendants, they try to catch the scruff of the neck. If you hold the scruff of the neck very tightly, imagine there is a small space. With the small space only animal is breathing. If your attendant or the technician giving lot of pressure here, and every possibility that will reflect on the narrow spaces area, and the animal will collapse. Immediately they collapse. It become unconscious, it become cyanotic, you may miss the patients. The message is, so these type of breed, the brachiocephalic dog, better you want to examine, sedate them, then you do an examination and identify the problems. Other procedure you want to do, suppose you're collecting the blood or you want to examine the animal, ask someone to restrain, not by tying the mouth, you cannot tie it. But by using the soft towel, wrap it around the body of the animal and keep them calm. Then you can collect the blood, or you can also suppose any medication he needs, you can administer during that time. So taking a CT scan will give a valuable information to you. You can also give a correct, detailed information to the pet parents, and they will also understand. And here you can see actually trachea, they fix the ET tube, and the yellow color, elongated soft palate, it's completely masking the trachea. Then how the animal will breathe? So since we put the ET tube here, so the animal can breathe better. So that's all about the information about the use of CT. CT, you can see the nasal elongated soft palate after taking a CT. That's the way they do it. Here again, I told you in the beginning of my one of the slide on how we need to examine, and where you have to cut it, and you can see the endotracheal tube in the trachea. The elongated soft palate, they cut it and remove it, and they put a simple continuous or a simple interrupt sutures to avoid the bleeding. The animal, they respond very well with this technique. These breeds, pug, I've been telling about the stenotic nerve, and it's having a lot of difficulty in breathing. See, the animal pant, it's having open mouth breathing, having anxious look. It is communicating to us. It's have a problem in the respiratory tract. Start from nasal cavity up to the lung. So it's our duty to address the problem, and it is our duty to keep the animal comfortable, and then go out with our technique. That's the message. And another important thing is this. So brachiocephalic breed. One more thing you have to understand. I'll keep the dog. One more thing, you see, they also having a protruded eye. And many occasions, some of the untrained persons, if they are restraining the dog, giving a lot of, normally this breed you should not restrain on the scruff. And if they give a lot of pressure, there are possibilities even the eyeball can come out. They call the exophthalmosis. Exophthalmosis can be encountered. So imagine that and be careful. Animal normally come for small issue. You should not make it as a bigger problems. And so gentle handling, flow by oxygen, and cutting the stenotic nerve area. These are all small procedures. It will give them a big relief to the animal. This again same pictures with each two, and we want to show with the everted laryngeal saccules and how it is inside. This has to be pulled and it has to be removed surgically. Then you can see the lateral thoracic radius of a bulldog with the hypoplastic trachea. Normally, a healthy lung trachea contain a lot of gas, and it will be black in nature. Hypoplastic trachea, instead of that horizontal layer filled with oxygen, instead of that, the elongated tube-like structure, you can see the thin-like structure in the X-ray. These are all things it will able to tell us about the hypoplastic trachea. And the message, whatever I told, is available online. And strategy for the management prevention of contamination related respiratory disorder, brachycephalic dogs. The detailed information available is free online. Maybe go through and you can understand much more information.
Hatvet Pharma presents Hatclav, amoxicillin and potassium clovonate syrup and tablets, aminopenicillin with beta-lactamase inhibitor. Hatclav is available in the following formats: amoxicillin and potassium clovonate oral suspension, Hatclav 250, amoxicillin and potassium clovonate tablets, Hatclav 500 tablets. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com. Thank you.
That will give much more detailed information to us. Yes, the message about the brachycephalic, whatever I told, my practical input I gave. And here I want to tell you about the theoretical parts. What are the globally how they are approaching the brachycephalic dogs, and what are the latest updates, how we should take care of the patients. All those things it will come in a subsequent slide. So, brachycephalic dogs are those belonging to group of breed characterized by severe shortening of the muscle, and therefore the underlying bones and more modest shortening and widening of the skull. That is the definition of the brachycephalic dog. It's a severe shortening of the muscles, and then shortening and widening of the skull. So these are all the anatomical confirmation of the brachycephalic dog. And the breeds commonly affected with the brachycephalic syndrome. So what are the breeds they commonly affected? One of the breed is English Bulldog, Boxer, empty number of boxers available in our country. I'll go back the previous slide. So the boxer owner should be educated. Boston Terrier, we don't have much, but it may be there. Less of show, many apartment they prepare to keep it. Boxer they prepare to keep in an independent house. There are people they keeping it in a flat also. And the pug. So this is the after arrival of Hutch phone. Now Hutch people entered into the mobile business. They started introducing the pug pictures. So everybody in India, they want to buy a pug breed. It became famous, a couple of years before. And throughout India, the demand is very high. Some of the people, they go to nearby country and buy these pug breeds. So with that available breed only, you can have a more number of pug in our country now. So that's all the statistics about the pug there. And Shih Tzu is again nowadays is very famous. When 25 years before when we start doing the practice, we used to get normally a lot of Spids, Doberman, Great Dane. Now I could see more number of Shih Tzu. There are Labrador maximum number available, but I could see a lot of Shih Tzu nowadays in the practice. Then Pekingese, Sherpie, French Bulldog, Cavalier King Charles Spaniel. These breeds, based on the research, they identify they are prone to get brachiocephalic problems, and then how we need to address and all those things I told you already, and we'll also going to tell you in the subsequent slides. Upper airway abnormality associated with the brachiocephalic breathing. Classical component of brachiocephalic syndrome, and we told you they don't have elongated soft palate, the brachiocephalic dogs. Some of them they may be having stenotic nerve. Actually, in the statistic, the subsequent slide you will identify. Stenotic nerve will be the highest percentage, followed with the elongated soft palate and the everted laryngeal cycle, and the other percentage of hypoplastic trachea. And we will also share it in the subsequent slide. Common concurrent finding because of elongated soft palate, stenotic nerve, everted laryngeal cycle. They have there are concurrent other observations. The animal strain, they're prone to develop hypoplastic trachea, airy epiglottic collapse. Concurrent observation we observe. Other finding: corniculate collapse, tracheal collapse, tonsil eversion, macroglossia. That's another macroglossia, bigger tongue. The tongue is bigger. Most of the pug, you see, is bigger than the size of the head. It will come out. And the tongue is bigger, there is every possibility to interfere with the normal inhalation and exhalation, inhalation. And they pant, they dyspneic, tachypneic, all those signs we observed animals which are having macroglossia. Glossia means tongue. I'll go back to the previous slide. Glossia means tongue, macro means bigger tongue. Pharyngeal collapse, imagine pharyngeal muscle innervations, very, very important. If there is a collapse, there is every possibility they have a strep or stenotic NARS related disorder and all these things. And then epiglottic collapse. These are all other findings with the brachiocephalic breeds. Boston Terrier, you can see the stenotic nerve. So the message, various breeds we are focusing at this various interval time. The message of doing this, so that all these breeds, when it comes to your practice, you can able to at least check this breed and alert the owner, ask them to give the better comfort to these type of breeds. Otherwise, because the birth problem, if you don't address that, it will be a tough life for them, and they prone to develop breathing distress and other organ involvement and so on. So this is about the CT image. They see the skull, how the brachiocephalic dog having and I imagine the dog which are having a long nose, how the skill confirmation itself. And also another important message in this slide, the dog which there is a one study, dog which are having long nose, they have a good detecting capability because the olfactory receptors are more. So when compared to human being, 2,000 to 3,000 times, they have a better olfaction capability. And then they can retain in their mind for after a couple of days, and so the message is the long nosed dog, they are able to breathe better, and they can able to perform better, especially when they are using for narcotic deductions, when they are using for any murder deductions, when they use for crime deductions. The dogs which are having long nose, naturally they have a good capability of detecting the smell because the availability of receptors. It doesn't mean that pugs or other small nose breed don't have receptor. They have, but compared to the long nose, the percentage receptors are very less. And but they also perform in the detection. So some of the airport I could see Shih Tzu. The people are moving with some narcotic drug. Shih Tzu can catch on them. some ladies, they'll keep in the hand. If they're moving with the narcotic drug, they train the Shih Tzu, they catch hold them, just to catch hold the shit. So, of course, in all airport in the world, they must keep the dog which are having long nose. They can use it for detecting coronavirus infected peoples. They can detect for crime. A crime may be so many means. Uh, Smuggling involves drugs. Smuggling involves various items. Dog can be used as a important force in maximum airports in the world, and it will give a good return to the country. Those who are having a these type of dog in the air force, they do a real job. So no other equipment in the world, no other creature in the world having so much of receptor in detecting or catch holding the smell like a dogs. Even if you have 1,000 vehicle coming to your house, they will remember your vehicle. There are lakhs, crores of people. You leave your dog in that, it will come and catch on you. It will come to you because of the smell what you have, the smell what they register in the mind. They can keep in their life for longer times, and so that they have a good bondage. So the message is, any country they want to identify the crime perfectly without any human adulterations. Dog is the good model. Dog is a good model in the sense, dog which are having long nose, they are good models. And I show it to some of the experts came for some lectures to our college, and I thinking that these people appreciate the German Shepherd Doberman because they have a long nose, they can use it for detecting the crime. Helpful to the police force, helpful to the army force, helpful to the border security force, helpful to the CRF force, helpful to the railway force. Even we are giving consultancy to Air Force, we are giving consultancy to the railway force, we are giving consultancy to the army, we are giving consultancy to the BSF, and we are also taking care of the dog used for earthquake disaster management program. We also give our help to take care of those dogs. And all these units, they have a pure breed with long nose. And after the arrival of some of the American experts from US, we conducted one program, and I showed my native breed dog like Rajapalayam Sipipare Bombay, thinking that he may say this dog may not perform better. He told, these breeds like Rajapalayam, Sipipare, Bombay, all they have a long nose. That means long nose dog, they have a good receptor in the nasal cavity. They can able to detect all the crime incidences. They can perform like your German Malinois or other Doberman or German Shepherd. So we insisted the police authorities, we told the army people, we told the border security force, we told the RPF, we told the CSIF, all these people to keep our Indian breeds, so they can also perform better. The message to the the society or the security agency, security people, and if we keep the dog, our native breed dog, the expenses will be minimum. Not only the expense, and the disease resistance very high in our breeds. If you bring a German Shepherd, Doberman or other breed to our country, their tolerance are very less, and they cannot tolerate our extreme climate. They cannot tolerate the extreme chill environment. And so the dog which are there in that particular state, they can adjust with that particular environment. They can have a better quality of life. This is all about the long nose and short nose. Short nose also have a receptor, but not like long nose breeds. Short nose have a lot of other issues like stenotic nerve problem, elongated soft palate, everted laryngeal saccule, obstruction. Here again, no, you can see the so you can see the elongated soft palate. It is interfere with the tracheal opening. That's what the arrow mark is coming. Here also you can see the animal with the brachiocephalic breech with less amount of oxygen for inspiration, and you can see the ET tube here, and the elongated soft palate completely obstructing the tracheal opening, and this tongue also bigger tongue. The bigger tongue also causes problem of inspirations. So, and here you can see the hypoplastic trachea. Normally, trachea they have a distended tube. You can see the distended tube with enough amount of black area or the oxygen. And but here you can see hypoplastic nature. Pathophysiology of brachiocephalic airway syndrome. As a result of the craniofacial and tracheal anatomy, brachiocephalic dog often must overcome increased resistance to inspiratory airflow, especially when their brachiocephalic features are accentuated. This is a multifactorial problem, commonly referred to as a brachiocephalic obstructive airway syndrome. So, the BOAS, brachiocephalic obstructive airway syndrome, is due to multifactorial condition. That's the reason they call it a syndrome. It's not a single entity. It's a syndrome, group of problem causing this discomfort to the short-nosed dogs. Traditionally, brachiocephalic obstructive airway syndrome has been characterized by neuronostic. This one study they observed 58% to 85%. Elongated and thickened soft palate they observed 87 to 96%. Everted laryngeal saccule 55 to 58%. And hypoplastic trachea 46%. This is the statistics. And practitioner like me, the practitioner like available in other places. The statistics is not important to us, but the problems are very important. Statistics very important for the academic institute, their analysis and the interpretations. But practitioner like us, these problems are very important. Simple problems, but it is a major problem. It causes death of the dog. So, just creating the bigger nose, bigger passage in the nasal cavity, that itself bigger relief to the animal. In one study, bulldog was the most common brachiocephalic dog, simultaneously affected by elongated soft palate, 55% of the things. Stenotic nerve, 39% of the brachiocephalic instances. Everted saccule, 56%. Hypoplastic, 54%. Laryngeal saccule, 40%. So, the bulldog has been used as spontaneous model for human sleep apnea hypopnea syndrome, that is called SAHS, sleep apnea hypopnea syndrome. Since the similar observations available in bulldog, they want to keep bulldog as a good model for human studies. SAH is a common disorder in human. They have sleep problems due to the other anatomical problem in the nasal cavity. It's actually the SAHs affecting 2 to 5% of the middle-aged population. 4% of the middle-aged populations affected with the sleep apnea hypopnea syndrome. Then it's a big problem. So probably the lot of research going on with the bulldog.
Hatvet PHARMA presents Hatpod, cefpodoxime syrup and tablets, the safe and effective choice for stubborn infections. Hatpod is available in the following formats: Cefpodoxime Proxetil disposable tablets, Hatpod 100 dt tablets; Cefpodoxime Proxetil disposable tablets, Hatpod 200 dt tablets; Cefpodoxime oral suspension, Hatpod 100 ds. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com. Thank you.
And the research available, they may be applicable to the dog populations. It will be applicable to human populations. There are respiratory consequences we'll get. The consequences of chronic upper airway obstruction on the lower airways and pulmonary parenchyma are largely unknown. It has been hypothesized that in order to overcome increased upper airway resistance, animal with brachycephalic obstructive airway syndrome generate greater subatmospheric pleural pressure on inspirations, thus creating more strain on intrathoracic tissue. Human with SAHS may generate a pleural pressure as low as -65 mmHg. So this pressure, this pleural pressure on inspiration, that will cause more straining on intrathoracic tissues. So if you can correct these problems, the animal can breathe better. They can have a good quality of life. In the intensive care unit setting, brachiocephalic dogs have shown to be more likely to require mechanical ventilation than non-brachiocephalic dog or brachiocephalic among dogs that we are presented to an academic veterinary teaching hospital. Aspergillus pneumonia was the leading cause of the respiratory failure in those same patients. So this already I told you. Animal with stenotic nerve, everted laryngeal saccules, elongated soft palates, they will not be in a position to get the proper oxygenation to the body through the nasal cavity to the lung, from the lung to the systemic circulations. So it is animal with less oxygen. When you do a ABG, if they are having less than 90% arterial blood gas saturated oxygen level, which if you check the saturated oxygen level with the help of pulse oximetry. Pulse oximetry, the recommendation for usage, you can use it on the ear flap, you can use it on the lip, you can also use it on the abdominal flank regions where you will have more amount of blood supply. They also suggest on the digits also you can apply. And some other they also suggest coccygeal regions. But my association with the pulse oximetry using on the upper lip will be convenient because a lot of blood supply on the upper lip that can give a good result of saturation of oxygen in the pulse oximetry, so that can give a proper reading. Other places and all, if you apply on the ear or the flank region or the digits, animal feel discomfort, every possibility it will it won't attach on the proper site, and you will not get the proper result. So another way of identifying the correct exact level of saturated oxygen level, you can do saturated oxygen level testing by correcting arterial blood gas analysis. Then how do you correct the arterial blood gas analysis? Just keep your finger on the femoral artery. There will be a femoral vein also, but femoral artery you will have a dominating pulse compared to the femoral vein. Keep your finger like this. Keep your finger like this. Imagine my bottom finger is the femoral artery, the femoral vein. Keep your finger like this, and then where exactly you are feeling the dominating pulse is the femoral artery. The less pulsation is the femoral vein. So what you have to do is, imagine my finger is the needle already coated with the heparin. You have to coat it with the heparin. Normally we use insulin syringe. I told you, there is a femoral artery and vein, and just introduce the needle into the femoral artery area, and if it is in the artery, the blood automatically will fill it in the syringe, it will come up, Already quoted with the heparin, it won't clot also. Normally the technique, initially 1 or 2 patients will have difficulties. If the animal may not be cooperate, the proper training people not available, you are also new, means 1 or 2 cases you may failure of this technique. But if you do another 3 or 4 cases, you will have a better perfection and you can collect the blood very easy. The idea of doing this technique, it is a bedside diagnostic test. You need not have to collect the blood in the peripheral vein, send them to the lab and getting the result tomorrow or day after or in the evening, not like that. It's immediately. Within 2 minutes, you will get the result on your team. The printout will come. There are small device. There is the high-end cartridges are available. Just collect the blood, and then the cartridges, the instrument will be like my mobile phone. There will be a there is a card. There is a cartridges available. It's like our your ID card. Your ID card like a tag available. That you have to insert it. Once you enter, and it will calibrate. Once it calibrate, and it lasts to load the blood. Imagine already heparinized loaded blood is there. Just load the blood. Once you load the blood, the load also technique is there. Once you load the blood, the machine will take a required quantity of blood. It goes to something. There will be a click sound you will get. Once you get the click sound, don't press syringe. If you apply too much pressure after hearing the click, then too much blood goes inside. The machine will say too much blood enter. Then it will become error. You have to use. You have to miss 500 rupees. You have to lose 500 rupees. So you cannot use the cartridges again. That's the way the company they have a mechanism like that to collect the money from the technique or the technology. So if suppose the card which you are loading, reader card, if it is expired also, it will not read. So we should use it before the expiry. So the message related to the mechanical ventilation, you are going to connect the ventilator to the patient, and how much is the saturated oxygen level of that particular patient, the artery will be ideal. Less than 90, you need to address that issue. If it is 80, 70 and all, animal is in hypoxic state. So we need to put a ET tube. I told you ET tube selection type, nasal septum you can use, or otherwise palpate the trachea. You can approximately identify the tracheal width. Then you can put the selected ET tube after applying lignocaine spray or lignocaine gel on the ET tube. Once you fit the ET tube, and you can connect the ventilator with the patients. And while you connecting the ventilator with the patients, there are too many technique I told. I told you can give the flow by oxygen, just bringing the oxygen source very near to the nostril of the dog. The animal can get a record quantity of oxygen. I told you 40 to 60%. But here, when you connect the patient with the mechanical ventilation, you will get 100% oxygenation. That is the idea. And another problem, mechanical ventilations, it's very, very important life-saving process, but it should be trained. Your hand and the team should be trained. And proper maintenance of the equipment is also very, very important. Without that, when if you are running an emergency unit, suppose you don't have an annual maintenance contract of that machines, then the maintenance not there means the performance will not be there. Performance not there means you cannot save the patient. You cannot save the patient means then you will have to face a lot of consequences. So the message is, once you identify the hypoxic condition, connect the mechanical ventilator. And one method, whether it is present in the trachea or in outside. If it is in the trachea, normally you know what you do. You just take a small thread and keep it in the tracheal incision part or the ET tube outlet. And when the animal inhale movement will be there, animal exhale movement will be there, thread will be moving like this. The tracheal, the ET tube outlet. Inlet is inside the trachea. Suppose if it is present in the esophagus, and you will not see this type of feather movement, tracheal outlet. That's one of the important step of the technique. in a critical care unit when you want to put the ETT. And sometimes if it is present in the esophagus, when you connect mechanical ventilator, it can supply 100% oxygen. The 100% oxygen, immediately animal develop bloat. And a couple of years before, there was a case brought for endoscopy, and we connected put the ET tube, and they connected with the isoflurane gas anesthesia. Then the faulty entry of that isoflurane gas anesthesia, they accidentally, it causes a bloating of the stomach. That means the ET tube enter into the esophagus rather than trachea. So once you connect the isoflurane gas, all the gas will go to the stomach, it causes bloating. Animal become developed a cardiac failure, respiratory failure, then it will collapse. Then immediately, what we do, we just stop the isoflurane gas anesthesia, and then ET tube we we removed it. Then we put it in the trachea. Then we deflated it. Deflated, we did the gastrocentesis, just put the needle in the distant stomach, relieve all the gas, and that will save the life of the animal. The message is faulty insertion of the ET tube into the esophagus. Naturally, it does gastric dilatation. And the step is you just remove it and fix the bigger bore tube up to the stomach, and naturally all the gas will come out very easily. If you have a problem of getting the bigger stomach tube during the process, just to do a gastrocentesis, just put the needle on the distant area, release the gas. That has helped the highest percentage of populations. And when I talked about the GDV or the GD management, I'll tell you elaborately how this is simple technique. It is not a gastrophyxy. It's not a gastrotomy. It is a gastrocentesis. Just put the needle on the distant stomach, relieve the gas, forget about the site, forget about the area. Once you identify the distended drum-like sound, distended gas in the stomach with percussion, or take X-ray, identify where exactly the gas circulation, then you put the needle, that will relieve the gas. So all those things you can overcome if you can put the ET tube properly. So these are all the complications you face when there is a faulty entry of ET tube into the esophagus rather than trachea. Management of upper way obstructive crisis in brachiocephalic dog. It will also end up with a progressive worsening of respiratory distress because of partial or incomplete airway occlusion. The airway is occluded, and some time back I heard one child, when she was using a balloon, the balloon burst. One portion entered into the trachea and it occluded. The child fainted. Then they did bronchoscopy and remove the balloon one end. The message is, if you are not handling on time, every possibility is the animal going for various complications, you may miss the patients. It can be direct complication of brachiocephalic obstructive airway syndrome, or may also follow an anesthetic episode in which upper airway musculature is further weakened. That also can cause this type of problem. The recent study, humidified oxygen delivered via nasotracheal tube, it can help rather than dry oxygen. If it's going via humidified oxygens, they found a better response in those animals. Surgical correction, and you can see stenotic nerve. What they are doing, amputation a la nasi. They're just amputating. Amputated a la nasi. Allopexy. And this is another correction, surgical correction. Alloplasty is another section. And here, you can see vertical wedge. cutting. There is a horizontal wedge technique. There is a lateral wedge technique. You can see laterally some portion they are cutting. In the overall process is making the animal to breathe better, keeping the respiratory tract getting opened so that they get maximum amount of oxygen, and then it can breathe better. All other problem like coma stage or multi-organ failures can be prevented. If it is an elongated short palate, they do staphylectomy. And then elongated short palate, they cut and then suture it, or they cauterize it, or they use a cauterized laser, and then or they use laser, thereby they prevent the bleeding and all. Another technique called folded flap palatoplasty is also another technique. They just fold the elongated short palate. In that also they found better success rate. So another important, everted tonsils, they do tonsillectomy. These are all the surgical technique they follow in correcting the brachiocephalic obstructive airway syndrome. The syndrome, if you want to correct the difficulty of breathing due to various reasons. So if you don't correct with all these techniques, simply giving the oxygen, you cannot become the animal to become. Simply giving the bronchodilator, simply giving the oxygen with humidifier, you cannot make them to lead a successful life. To get the successful life of the or provide the successful life of the dog, you must, if the animal is carrying any one of the issue, stenotic nerve, elongated short palate, everted tonsil, that has to be corrected. If you don't correct that, it will have keep recurrence. There are occasional advanced stage, you may miss the patients. You can see stenotic nerve, how the various resections technique they are following. I'll go to the slide. See how they are doing amputation, alloanasy, allopexy, alloplasty. Under that, vertical wedge, horizontal wedge, lateral wedge. If it is elongated short palate, they do staphylectomy or folded palatoplasty, everted tonsillectomy. All those things we should do on time. The more you delay, more the mortality. That's what they do. If you identify the problem, better do it at the as early as possible. The more you delay, more the problem, more the mortality. This again already told normal and stenotic nerve, and the portion of dorsal nasal cartilage to be removed. Sometimes with the cartilage lysis, this has to be removed. That's the message of this particular slide. Now, how they are keeping the theaters? Animal should be in standard occupancy, suspended with maxilla suspended and mouth wide open for resection of elongated short palate. When you have a device like this, when you have a rope to open mouth like this, and then the animal should have been with the isoflurane gas anesthesia after the intubation. Then only you can do the process very easily. Otherwise, it's become cumbersome and tight. Laryngoscopy view of everted laryngeal saccules in a bulldog, and you can see the everted laryngeal saccules here. Retroplex endoscope view of a nasopharyngeal turbinate, how it look like. Laryngeal scope view of an elongated short palate. And try to keep a laryngoscope in your practice. And if you have a good practice, better keep the endoscope. The light source, it will help you to detect various investigations. That brush water, it will help you to take.
Hatvet Pharma presents Hatclav, amoxicillin and potassium clovonate syrup and tablets, aminopenicillin with amoxicillin and potassium clavonate oral suspension, Hatclaf 250, amoxicillin and potassium clavonate tablets, Hatclaf 500 tablets. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com. Thank you.
Cytology. There are biopsy force to help you take biopsy. And we have recorded one laryngeal adenocarcinoma that was in the elongated short palate. That was in the obstructing the caudal part of the oral cavity. And then surgically resected, it became all right. And the paper also available online. Laryngeal sarcoma obstructing the tracheal openings area. How we manage it and all this. Now you can see in the pictures how the aortal laryngeal sac put an incision, how they put the snare and then bring it out. If they can do on time, then will feel better. Post-operative image of the vertical wedge resection of right nasal cartilage. See the after the resections will be like this, and it will heal. There will be any problem. There's a bleeding, just we are telling. Sometimes nasotracheal tube intubations. Animal need oxygen. No? There are various methods of oxygens because of stenotic nerve, everted laryngeal saccule or elongated short palate, and they have what do you call less amount of oxygen. They get less amount of oxygen to provide maximum oxygen. This is also one of flow by oxygen one method, face mask is one method, cage method of oxygenation is one method, mechanical ventilation is one method. And mechanical ventilation, we put ET tube through that we connect. There are occasions, we can also administer the oxygen via nasotracheal tube intubations. And through nasal cavity, pre-measure the length from nasal cavity up to the caudal part of the mouth. Then you introduce the tube directly into the trachea. Then connect the oxygen source and then supply the required quantity of oxygen so that unconscious animal become conscious. I don't always breathe well, but when I do it, it is with an ET tube. It's just a saying we got it. We thought of doing it. There are complications. Upper digestive tract disorder have been recognized in brachycephalic dog. An endoscopy study evaluated the esophagus stomach of brachycephalic dog that were present of the airway disorders. 97% of the subjects had abnormality in the esophagus. 97% of the patients they had abnormality in the esophagus. Like it may be esophagitis, hiatal hernia, gastroesophageal reflux, pyloric hyperplasia, atresia, gastritis, duodeноgastric reflux, or duodenitis. These are some of the problems encountered with the gastrointestinal consequences. These are the book Small Emergency Critical Care Medicines by Deborah Silverstein. And these are all the nutshell information about brachycephalic obstructive airway syndrome. The nutshell message is the practitioners or the policymaker, academic institutions, and whenever you get this type of brachycephalic breed, a careful examination of the practitioner and careful examination of nostril, careful examination of oral cavity, careful examination of the endotracheal tube intubations. And once you do that, you can identify this problem. You can correct the problem well in advance. The dog which had all these complaints, better you can avoid them breeding subsequent time. So those things, you should keep in your mind. So when you do that, you'll have a better set. Then another thing which I told you in the beginning itself, client counseling is very, very important. If you don't provide the proper client counseling, the client will move from one place to another place. Pets like a family member nowadays. The pet parents they're ready to spend time, money for the welfare of the pets. So it is the responsibility of the veterinarian student to take care of the pets. If you keep the pets only, you will understand the problems. And the majority of them, if you don't, majority of them you don't have. And kindly keep the dog or the cat or birds or a small zoo. Keep the small zoo in your house so that many patient will get benefited. The direct advantage is sometimes you can also uh, if suppose the dog need blood, you can collect it from your shelter dog. So like that, so small help, you can get it from your shelter. So these are all the world guidelines about the brachiocephalic obstructive airway syndromes. As and when get that some more input, we'll share it with Hatvet PHARMA. They are the educational partners. They're spending time, money for the educations. No, nowadays the child not talking to the parents not talking to the child, and where is the time for the animals? So there is a pharma, Hatvet PHARMA. They have a time for the animal. They want to provide the technical input or the technical update to the practicing veterinarian all over the world. They spend time, money for the betterment of the professions, and I salute them. And we'll meet with some more update in the subsequent webinar, critical care webinar.
For placing order, contact our sales team, WhatsApp at 98372 53817 or visit www.hatvet.com. Thank you.